Today we're going to work on Jane, and I'm going to demonstrate the TMJ protocol, the holographic technique protocol, and the hyoid, how we're going to evaluate and treat hyoid, because we may find, we've been working on Jane's jaw here lately, and we may find all three of those things. So I won't talk too much about what I'm doing as we go through, because this kind of matches up with the slides. I went through it in detail on the slides. So I'm gonna do all three of these exams seated, and I'm going to use a piriformis or a quad, depending on which one tests strong in the clear. So we'll do a seated piriformis test, and that's really good. That's very nice. Let's just check the quad too. Push up. Good. So try this side here, push up. So everything's firing pretty well there. Now I'm going to ask you to not touch anything around your jaw first, and I want you to just bite down. Okay. Now I want you to open big. Now neither one of those weakened. If they had, biting down, we would suspect maybe something going on with one of the teeth, and we would go in and check that one. That didn't show up, at least this time around. An opening would have indicated that there is some fascial flush need in either the masseters or the temporalis muscles, the closing muscles. That didn't show. So while we have you non-TL, I'm going to have you protrude your jaw. Good, and then retrude. Now those didn't show either, so that's good. Now just lateralize your jaw one side. Oh, there we go, and then the other side. Okay, so lateralizing to the right. Okay, now take your 3 fingers, and I want you to actually use this hand. Touch your right masseter first and lateralize. Okay, so we got lucky. That re-strengthened the indicator muscle. So that indicates that we will need to do fascial flush on the masseter. Now, we won't do that quite yet. Now I would like you to take your 2 hands and, no, before we do that, I want you to take your 3 fingers from each hand and touch your TMJ. So basically, you want the patient to touch the TMJ and not touch a lot of other things. So right there. Now relax the jaw a little bit. Okay, push in. Good. Now bite down. Okay. Now open big. Push. Good. Bite down. Okay, so we get a weak indicator muscle. Now that indicates that we have a need for spindle cell reset in the closing muscles. We don't know if it's the masseter, we don't know which masseter it is, or if it's the temporalis. And I'm going to have you come down and just touch the right temporalis first.
You mean the masseter? I'm
sorry, yeah, the masseter. And bite down. Okay, now touch the other side and bite down. Okay, now take that away again. Now touch both sides again for me.
Bite down.
Okay. So take this hand away, bite down. Okay, put that hand back and bite down. Okay. So it indicates it's on the left. Now we already found possible need for fascial flush on the right. Would make sense. We might have a need for spindle up on the left. Now, since we're here, let's have you go to the right side of your jaw. I want you to TL the area near the mentum and near the actually down on the there you go, on the ramus or on the body. I'm sorry, the body. So we're TLing the proximal and distal part of the body of the TMJ.
With teeth type?
Neither one. Yeah, just relaxed jaw. Now go to the other side. Same thing. The proximal and the distal part of the. Okay, that didn't show. That's good. Now come back to the right, and we're going to have you TL the body and the ramus. So right about here. There you go. Okay, now go to the either side of the menti, symphysis menti, and then go back to the body and ramus this way. We're looking for a holographic, and there it is. We're looking for a holographic subluxation, and that's basically bent bone. So I'm going to have you breathe in and breathe out. So the in-breath negates the finding, so we're most likely going to challenge it and correct it. We're going to correct it on in-breath. Now, that's holographic. Now we're going to go to the hyoid, and I want you to just maybe with one hand, just gently get a hold of the hyoid. The doctor can, the examiner can do this also. But now just TLing the hyoid, nothing there. Now just gently push your hyoid to the left. Okay. Push your hyoid to the right. Okay. Push your hyoid to the left. Okay. So pushing the hyoid to the left causes a weak indicator muscle. So that's going to tell me that there's some imbalance between the hyoid muscles. Now we don't know which one yet, but we're going to find that after we treat the TMJ and after we treat the holographic subluxation. So I'm putting on gloves because I'm going to go into Jane's mouth, and now we could have had cranial stuff that we need to fix, but we're just going to focus first on the TMJ. Now we have a right masseter that needs a fascial flush, and we have a left masseter that needs spindle down. So first I'm going to have you just turn this way. Hopefully you can see what I'm doing. Now you can use oil or lotion. It works really nice. But I also will a lot of times just kind of work across the fibers and kind of flush them down this way. And remember, the fibers run at different angles, so you can go several passes at each angle. Idea is I want to flush down this way. There we go. And there we go. Okay, now this side is, we're going to spindle this down, and so this is a little uncomfortable. You want to be as gentle as possible, and you just want to come into that muscle and try not to push too hard. Remember, you've got a parotid gland there and all kinds of sensitive tissues, so we want to come in and just bring that together, trying to get those proprioceptors to reset. Good. Now I'm going to have you open your mouth, and I put my thumbs right on her lower molars. I want you to gently bite down. Okay, now this, okay, relax. I've never been hurt doing this. I've done this hundreds of times. Patients never seem to bite me too hard. It works really well. But my thumbs in between their teeth gives me a really good idea of whether there's a change in, if there's a difference in vertical dimension in the two sides of the TMJ. And so I start with that. Go ahead and gently bite down. Good. Now let your jaw relax. Now I bring the jaw forward and back, and I'm looking for the normal glide. And you can see she has really nice glide, and it's pretty symmetrical. But when you do this, now it's a little tighter on the left, going back. Now that's going to indicate that there's an external pterygoid, possibly, or possibly a posterior temporalis on this side. Usually it's a pterygoid. Now go ahead and bring your jaw to the right. There we go. Let it relax. Now I'll just move the jaw back and forth. Go ahead and open and then move to the right. And have them, okay, let it relax. Good. Let it go. That's starting to feel a little more symmetrical. Now go ahead and open again. Close. Good. Open. And then gently bite down. Okay. See, that reveals, after doing that, it reveals a little bit more vertical dimension on the left. Okay, then open. And bring your jaw to the right. And I'm just going to press up into the lower division of that external pterygoid and just give it a little stretch. Bite down. Good. Okay. That's pretty good. Open again. Good. Now, we could go back and retest using the indicator muscle, but we're going to go ahead and do the holographic subluxation. So we're going to do we're going to correct the holographic subluxation between the body and the ramus on the left. So let me have you bring this arm up. We'll see if we can use that as an indicator muscle. It works pretty good. We can also use a teres minor. Yeah, I like this one better. Okay, good. So I'm going to go in here and I'm just going to press two different directions. And okay, so that worked. I just sort of, it was more of this. Now breathe in and hold. Good. Breathe out. So I'm challenging it and seeing what phase. Breathe in. Phase of in-breath, once again, of course, and that's the same thing that happened when we were TLing. So I'm going to ask you to breathe in. Good, let it go. And as she's taking deep breaths in, I'm trying to get on that. And this is a common holographic subluxation. You can find them anywhere in the body, but this is a very common place, which is why we like to teach it along with TMJ. It's pretty good. Ooh, I think that went. Okay, so I'll just challenge it again. No, still there. Breathe in. Okay, still there. Okay, so we didn't get it all. So I'm going to have to go in your mouth. You okay? I'm inside. I'm right on the internal pterygoid. And I'm going to be pushing this way. And, okay, and open. And I'm going to go a little lower. Okay, that worked. Breathe in. Okay, good. I'm really right where the ramus meets the, I'll breathe in. Body, let it go. And again. And again. You okay? Always watch their eyes. Breathe in. And one more time. That hurt a little bit. Okay. Good. Now, let's just, you okay? That was, just going to give that a little challenge again and see if we need, okay, that's, I'm going to leave that for now. Now, we're going to be moving to the hyoid. Now, we found when Jane was sitting up that she weakened when she translated her hyoid to the left. So I'm going to use a strong indicator muscle. I'll use this one again. I'm going to come in here on the hyoid, and I'm just going to gently guide it back and forth. You never want to pinch it or be rough with it. And I can tell it actually sits a little to the left. Now I'm going to press this way as she goes weak. Breathe in. Okay, breathe out. Okay, I'm going to press a little different vector. I'm pressing this way, sort of to the left and posterior. I'm pressing a little to the left and anterior. And just straight to the left. So straight to the left, actually that gives us the most, I think. So breathe in and, okay, let it go. So I'm doing a static challenge. So when I go to the left and it weakens, that it tells me that I need to release the muscles that we're stretching. So the idea is to spindle them down. It's hard to get on them. I'm right here on the digastric and mylohyoid. There we go. Now you just kind of have to pick your way through these muscles, and keep challenging. Now that's better. I'm going to go down a little bit more posterior. That's still pretty good. I'm going to bring it back to the right. I'm going to bring it anterior, and I'm going to push it straight posterior. Ooh, there we got something. Now, breathe in. Okay, so straight posterior is going to be digastric and mylohyoid right up in here. So I'm going to be pushing, I'm going to be stretching that a bit. Trying to just spindle down those muscles. You okay?
Mm-hmm.
Pushing straight back, that's pretty good. Good. So I'm happy with that. So let's do this. We're going to then sit our patient back up and go through the same test again and see if we corrected those subluxations. So we are back where we started. Let's have you push in, hold, good. Now I would like you to, what was the first one we found? It was jaw to the right. No, jaw to the left, that's right. And, okay, so open your jaw and go to the left. Okay, good. Go to the right, good. Bite down and open big. Okay, so none of that shows. I'm pretty happy with that so far. Now let's do the TL. 3 fingers, go right on the TMJ, joints themselves, and bite down, and open big. Big, big. Very good. Okay, good. Now I would like you to TL the between the body and the on both. Yeah, go do both sides. Okay, go to right here. This is checking for our holographic subluxation. And then here,
Same side.
other side, yeah. Only just just here first. Good. And then there. So so everything cleared that we tested for. So I'm pleased with that.